Hello, my name is Dr. Thomas Kislan. I'm the founder, owner, and medical director of Hazelton Eye Specialists and Stroudsburg Eye Specialists, two large multidisciplinary eye care practices in northeastern Pennsylvania, which also has subclinic dry eye offices in each location. Since I started the dry eye clinic, patients have traveled significant distances to find relief from mild, moderate, and severe dry eye. Because of this, the practice has made it its goal to invest in the best technology in dry eye treatment.
Hello, my name is Dr. James Deom, and I am an associate doctor here with Dr. Kislan. And I have actually started a specialty subclinic within the same clinic for specialty contact lenses, specifically scleral contact lenses, called the Scleral Lens Institute. Since almost all patients needing specialty lenses have some form of corneal irregularity, they also have advanced or even moderate stages of dry eye, needing advanced treatments for dry eye.
Our practice has a tested, evidence-based approach to treating dry eye. This approach references the DEWS workshop and other major dry eye summits. We impose all methods of treatment, including cyclosporin drops, anti-inflammatory drops, punctal occlusion, oral doxycycline and azithromycin, omega-3 supplementation in the triglyceride form, and most recently have employed more advanced treatments like scleral lenses, amniotic membrane treatment, LipiFlow pulsation therapy, and now MiBoFlo. We have learned that to truly be successful in treating dry eye, we must treat both the evaporative form and the lacrimal deficiency form of dry eye disease. Dry eye disease affects millions of people and results in millions of dollars in lost production, and therefore is a major health issue in the United States. To truly attack this disease and be effective at treating it, you have to start with the evaluation and testing. Here at the Dry Eye Center of Northeastern Pennsylvania, we employ surveys, osmolarity tear testing, inflammatory tear testing, Schirmer scores, tear breakup analysis, LipiView, sodium fluorescein staining, MiBoM expression, MiBography, and lissamine corneal staining. We would encourage anyone interested in starting a dry eye clinic to utilize these techniques, but really you can get started using much less.
Of particular interest in the above-mentioned list of evaluation techniques for dry eye is MiBoM expression and MiBography. We find that this is a severely underutilized technique in correctly diagnosing, evaluating, and treating meibomian gland dysfunction and evaporative dry eye disease. All too often, practitioners will look at a patient and see a thickened erythematous lid margin with collarettes and diagnose blepharitis, and ask the patient to do a warm compress and lid scrubs twice a day. Unfortunately, we know that a large percentage of our patients will either incorrectly do this or not do it at all.
What we would like to do is express our patient's lid from the temporal to the nasal area and grade this expression as we're doing it. This gives us an idea on the extent of meibomian gland disease that is truly present. The next step is to photograph or video this to actually show the patient. Nothing is more impressive to the patient that there is a disease process taking place in their lids than to see the toothpaste-like secretion emanating from their lids.
Once this has been viewed by the patient, we will then take a transilluminator and place it under the lid of the patient and view the presence or atrophy of the meibomian glands in each section of the lids. Photographs are also taken of this for the patient to see. This is the most powerful photo to show the patient. We know that individuals are born with healthy, full meibomian glands and that their dysfunction over time will result in their atrophy. This is akin to glaucoma. If the disease is not treated and the presence of high pressure is not lowered, the optic nerve head will slowly die, and once it is gone, there is no way to bring it back. This is the way we need to start viewing meibomian gland dysfunction. We treat glaucoma because we know it is irreversible. We now know that meibomian gland dysfunction is as well.
With the increase in the aging population, we're seeing many more patients in their 70s, 80s, and even 90s. Unfortunately, many of these individuals have severe dry eye disease and meibomian gland disease from severe gland atrophy that was not treated years prior. We now have a successful, effective treatment to avoid meibomian gland disease, related gland atrophy that can avoid years of discomfort and millions of dollars in healthcare costs for many individuals in their elder years. This treatment is MiBoFlo. The MiBoFlo utilizes a constant flow of sustained heat and manual massage to empty the glands of the diseased meibum, creating a clean exit for newly created meibum and kickstarting the creation of new healthy meibum.
The way we explain it to patients is this. You have a disease condition going on. We show them the meibum coming out of their lids, and also the lack or presence of meibomian glands in their eyelids. If they have all or some of the glands remaining, we stress the importance of preventative care that the MiBoFlo will provide to them. I like to liken it to regular dental hygiene appointments. Warm compresses at home are good, and they're like flossing your teeth, but you cannot replace brushing your teeth and flossing them with regular hygienist appointments, because they're able to clean your teeth much more effectively. Patients get this, and they get that if they do nothing, the condition gets worse. So many times we will have the patient try the warm compresses and lid scrubs and recheck the glands. If there is little to no change, then we know, and the patient knows, we need to do something more effective.
So some of you may think to yourself, well, that's all fine and good, but how do I sell this? Well, I would stop you right there and ask you if your cardiologist would consider if they were going to put you on a blood pressure lowering medicine to avoid a stroke as selling you the medicine you need. The answer is no, they would not. We know that this condition is irreversible and can cause years of discomfort and loss of function. So you're not selling it, you are prescribing it, and you are doing your patients a disservice if you are not aggressively treating meibomian gland dysfunction, because we know that not treating it leads to gland atrophy.
We have come up with several treatment protocols. We have found that 3 sessions of 10 minutes separated by 2 weeks to 1 month is an effective course of treatment for mild to severe meibomian gland dysfunction and can resolve symptoms and improve signs and symptoms for 6 months to a year. For this 3-session treatment, we charge our patients $450, and we have a technician who carries out the treatment. We do pre and post MiBoFlo evaluations and code them as 9-9 level medical visits. For more severe meibomian gland dysfunction patients, we also have a dry eye VIP program, which is $750 and includes a year's worth of doctor-prescribed and directed medical MiBoFlo treatments. Many of our patients really enjoy the treatment and describe it as an eye spa. But the real joy comes when they notice the change in comfort in their eyes after having the therapy done.
In addition to one-time 3-session treatments and the VIP program, we also offer patient a complimentary 8-minute treatment to really see if this is something that the patient may want to invest in. We let them know that this is not meant to be full efficacy of the 3-time treatment and is instead meant to give them a sneak peek at what the treatment would feel like. We have found that this has significantly increased our capture rate in offering the MiBo to patients who truly need it. Another really great application of the MiBo is in acute symptomatic hordeola. We educate the patient that they will need to do warm compresses, lid scrubs, and start the appropriate oral antibiotic if necessary, but describe how the MiBo treatment with the single applicator of the infected meibomian gland or sty can speed the resolution of the painful condition. We charge $75 for a one-time treatment for 10 minutes just to the affected area. This treatment can also be employed to achalasia.
One of the best parts of the MiBoFlo is its flexibility. And what I mean by that is it allows you to be flexible and creative in its treatment protocols and evaluations. There are no consumables or click fees, and so as much as you use the device will be as much as you're helping your patients and as much as you are growing your dry eye and meibomian gland dysfunction practice. Dr. Kislan and I really enjoy working with the MiBoFlo and would invite you all to call or email us at any time if you have any clinical or practice management questions regarding its use.
I have been lucky to travel the world lecturing to other physicians about dry eye disease. Most recently, I was on an esteemed panel of thought leaders on dry eye disease and the acceptance of a treatment protocol. One of the main conclusions of the summit was that we as a profession are not where we should be in treating dry eye. The way we look at it in our practice is that when a patient comes to you with a problem, they're looking for a solution, and it's up to us as the profession to find that solution. All too often, we're apprehensive about placing a patient on a medicine or prescribing a treatment because of what we may perceive to be a possible barrier.
I think most eye care providers are very familiar with glaucoma, and so I will use glaucoma as an example. When a patient has glaucoma, we view that as a medical eye condition and treat it appropriately. We know that the standard of care involves regular visual fields, gonioscopy, pachymetry, OCTs, pressure checks, and now even VEPs. We see these patients back on a 3, 4, or 6-month interval depending on the severity and stability of the condition, and bill these patients appropriately for our services at 9 level E&M codes. Dry eye is the same thing and should be viewed the same way. When you are evaluating dry eye correctly, you will find it. And to be able to treat it correctly, you need the advanced treatments that are available today. And MiBoFlo is a must on that list.
A big buzz in eye care today is medical eye care and growing that part of your practice. If you're wanting to do that, a great place to start is with dry eye disease management. It requires a relatively small investment in equipment, and you will build the most satisfied, loyal patients ever because you took the time to solve the problem that they had for years and so many other doctors decided not to fix it all.